Hey, good evening, Mr. Abdul Razak. How was your day?
Fine, thank you very much.
Really, thank you for coming down, because I saw your photo and I saw how crooked your knee was. I was quite impressed. I was very, very impressed with the fact that, you could walk so straight after seeing the original picture. I understand that you took a long time before you actually went for your surgery. Why is that?
Because at that period of time was advised by another doctor that I'm still quite young and the process of total knee replacement won't last until about 10 to 12 years. Then they asked me to wait until at the age of 57, then they can do my ops on the total knee replacement.
Were you living in pain when you had that, very bad condition?
It's very painful when you cannot walk too long. Then climbing up the staircase, going down the staircase is quite painful.
Okay. But when you did that knee replacement, what made you decided to do at 57? Because I understand that you told me that you actually had to literally wait it out.
Because when I went for my medical checkup, that is where I met Dr. Chan, and he advised me to do the ops on my total knee replacement. Because my knee is very bad at that time.
Yes, I could see, you were actually having almost bowed, to the side already. And you were still working then?
Yeah, I'm still working as a technician. No, I need to do squatting a lot, and it caused me a lot of pain.
You mean you live with all the pain all these years when you were 40 something to 50 something?
Yes, it was about 10 years. The pain is very quite painful.
Was it unbearable?
As what I see, at times I know it's very unbearable.
So do you still, with that pain, how did you, you literally go to work and just go home because it's causing so much pain during your work time?
I use knee guard at that period of time just to hold on to the pain, and I use plaster, medicated plaster.
When you decided to do your knee surgery, how was the process?
The process take quite some time. I think around 4 hours. After the ops, on the second day, I think, they asked me to walk slowly. Then gradually later, slowly you can walk.
When I saw your after picture, you really look like, a total person. If I didn't know it was you, I wouldn't have recognized because your knee was completely straightened up and you really look like a different person altogether. How did you feel?
I feel very good, but first and foremost, you need to do your exercises. This physiotherapy, they teach me how to do the exercises. Then most of the time, I do my exercises. Then I going up the staircase, going down the staircase after the ops.
If you had known Dr. Chan earlier, would you have gone for the surgery earlier?
Yes, if I know Dr. Chan earlier, I do the surgery much more earlier rather than bear the pain for quite some time.
Because I think it gave you a new lease of life, right, with this new surgery or with this knee surgery.
Yeah, you can feel much more better. You can walk longer. You can climb up staircase, going down staircase. But of course not. You can do brisk walking for quite some time.
So I think you said you did it in 2017. This was before COVID. So did you go on holidays with your family after the surgery?
Yes, I did go on holiday. After the surgery, I went to Turkey.
Wow, Turkey. So you mean in that 10 years before your surgery, you didn't go on any holidays, right? Because so painful, right?
Short trip lah.
But you were bearing the pain when you were traveling?
Yes, so. In 2016, if I'm not mistaken, I went to London.
How was it?
My knee, I couldn't walk that long,
So it was quite, though it was London, but it was not an enjoyable holiday with the family.
Yeah,
right?
because at period of time, very painful. No, you need to do a lot of walking.
So would you visit London again now, after or when they open up, then you can see London without pain?
Yes, of course. I much more prefer at this period of time after the ops.
Despite the fact that you're older, but your knee is working way better, right?
Yes, it's much more better.
If you had any friend that has got knee pain in their 40s, what would you recommend?
I ask them to go for a total knee replacement if possible, rather than you bear the pain for a few years.
Because I think the material used these days are also a lot better. It's also giving them better lease. I think it lasts you 20, 25 years.
I think it's much more better nowadays. The technology is much more better. Can last you for quite some time.
Thank you so much. And any last words for, Dr. Chan?
I would like to thank Dr. Chan for doing the ops on my knee and recommended me.
Oh my God!
Amazing.
Amazing, right? Wow!